After expanding across neighborhoods and communities nationwide for decades, major drugstore chains are now struggling to stay afloat. Rite-Aid has filed for Chapter 11 bankruptcy protection and plans to shutter more than 150 U.S. stores. This comes amid slowing sales and mounting lawsuits over the opioid epidemic. CBS and Walgreens also plan to shutter more than 1,500 pharmacies across the country. And public health experts are warning that these drugstores are closing in mostly low-income neighborhoods. So I want to bring in Dr. Curry-Winchell. She's a family medicine and urgent care doctor who's spoken extensively about health equity and health literacy. And that's where I'm going to start. Yes, for a lot of people, it's going to be a real pain that their local pharmacy is shutting down and they're going to have to go 4 more blocks to get to another one because there's pharmacies everywhere. But for some communities, a pharmacy shutting down, particularly underserved communities, can have a more pronounced impact. What are your concerns?
That is exactly correct. When we look at the fact that a lot of these pharmacies are in areas that are underserved, communities of color, and not being able to access not only food and staple items, but your medications. And so when we look at the rate of disproportionate disease in those communities, and the fact that they are closing down access, this is a huge problem.
And I'm curious, is there an overlap between, people are calling this a pharmacy desert, right? Where there's no pharmacy in your area. Is there an overlap with pharmacy deserts and then food deserts where there are no grocery stores?
There are. We have seen that there are several neighborhoods, primarily communities of color and rural communities, that don't have access just to healthy foods. And then when you look at the fact that the pharmacies aren't there as well, there's no wonder why we have this, widening gap of health inequities and disparities. So this is just another step in really a rate of disease that are impacting so many different people.
And what I thought about these pharmacies, too, is, yes, they're a place you can get shampoo and get your drugs, but there are also other little things like, some of them have like blood pressure testing machines there, just like little things that you can sort of check in with your health without having to make an appointment. Of course, a lot of people got tests for COVID and vaccinations for COVID back during the pandemic. Can we talk about the factors driving this change and not just the chains, but also the local pharmacy, your independent pharmacy, that's been disappearing now for like the past 50 years.
Yes. As a physician, I rely on my local pharmacy for my patients because that's where I'm going to ask them to go to get their medications, not only prescription, but over-the-counter medicine, as well as you mentioned, blood pressure machines, all the things that are essential to really having optimal care. And then when we look at the fact that the footprint of these pharmacies no longer have what they had before, that is what's driving these closures. But unfortunately, that closure is impacting patient care.
Dr. Curry-Winchell, I could talk to you so much more about this because, there's insurance, Medicare. I know with my pharmacy and my insurance, they've sort of increasingly pushed me towards using their online services and not going to my local pharmacy. I'm sure that's having an impact. I feel like we're going to be revisiting this topic at another time, but we're running out of time now. Dr. Curry-Winchell, thank you very much.